that 135 students have so far tested positive for COVID 19. The service is awaiting the results of further tests. Health officials say a major concern now is how to contain further community spread, especially with day students who may have mingled with family and friends at home. Patrick Kum Abwaje is the Director General of the Ghana Health Service.
We've also had to do some strategic testing of all these students to identify and contain the community spread. For the current situation, about 500 students are there. And so if there's an outbreak there and they are going home and they are coming back, it's a group of concern to contain community spread. And that is why we've had to test all these students from that. We're now going to follow them up to their homes and see how we can enhance contact tracing and do further testing for their contacts.
There are also concerns that some staff may be refusing testing. The Director General of the Ghana Education Service, Professor Opoku Amankwa, says that they will be engaging all concerned to address this challenge.
For the staff of Achimota in particular, we are arranging a meeting with them to encourage them to do the testing. We've had a number of them coming up to do their tests, but most of them seem to be shying away from the tests. But we're going to encourage them to do the tests. Doing the test doesn't mean you have it.
Right, that was Professor Opoku Amankwa. Meanwhile, Ghana is beginning to experience an increase in its active COVID-19 cases. Dr. Kumi Abwaje says of particular interest is the outbreak that we're beginning to see in schools.
Currently, there's a gradual increase in the active cases over the past 3 weeks. The average daily case count is about 80 cases per day, and if you look at previously, we were reporting 30, 40, and 24 thereabout, and so that means that there's some slight edge in it. But this is a result of some pockets of outbreaks reported in Ashanti, Ahafo, and Greater Accra. These involve health facilities, some working places, and the schools, the school particularly.
Dr. Patrick Kuma Abwaje there speaking. Okay, so today our guests to get into this, first of all, leader of Global and Infectious Disease Research Group at KCCR and a senior lecturer at the School of Public Health at KNUST, Dr. John Amwesi, joins us over the phone. Dr. Amwesi, it's always a pleasure. Good morning to you.
Good morning to you and to all your listeners. Certainly a pleasure to join you this morning.
Excellent. We'll be hearing more from Dr. Amwesi on the new status of COVID-19 in Ghana after these messages.
Come Charlie, right now, dear, the printing business slow. Power problems every day. I'm not able to meet client demand, and it's a big worry.
Charlie.
But Charlie, you actually bought that heavy generator as a backup power. Business is good for you.
Thank you, bro, but I didn't buy it. I rented it.
Sir, away.
From the generator experts, of course, Anointed Electrical Engineering Services has added rentals to their wonderful services.
So you mean, apart from the sale of quality generators and spare parts with their impeccable 24/7 after-sales maintenance and services, they also do rentals?
Exacto, man. Anointed has a wide range of generators from 5 to 1,000 kVA ready for rentals, my bro.
I see. They are still at number 77 Anointed House off the Odokomalam Road in Accra, right?
And in Kumasi, Anointed is in the city-style building in Amakum near Ashefem, and all Anointed branches across the country are still operating. Call their hotline 0243 480 334. Anointed Electrical Engineering Services, still the generator experts.
Once again, Melcom, your number one stop-shop supermarket, is getting bigger, better, and super mega.
Great news here. Now with over 40,000 items under one roof, ranging from electronics, homeware,
kitchenware, furniture, home decor,
electricals, supermarkets, and groceries.
All these at one shop.
Oh yeah, you heard right.
Your shopping experience just got really better.
Melcom, your number one stop-shop supermarket for all your daily needs.
Terms and conditions apply.
Melcom, where Ghana shops.
Hello. Oh, Charlie, how be? Bro, I need some help. Right, my money all finished. And month no end, so I make hot pass. I fit see some small loan for your side there, I beg.
Oh, bro, Charlie, I make hot pass you. My landlord today can't take your rent.
Oh, Charlie. All right, you make a call another person. Charlie, I need some help. Right, my money all finished and month no end. So I make hot pass. So you see, I feel
The number you are trying to reach is not available. Please call back later.
Hey, Adane. Kelvin. Yes. You make hot. Charlie. Rough.
So make today payday with Cowbank Salary Advance. Get an advance of up to 80% of your net monthly salary before payday. Just visit the nearest Cowbank branch or you can call our toll-free number on 0800 500 500 to find out how you can apply today.
Cowbank, forward together.
As a pandemic.
Coronavirus.
Coffee in your
COVID-19.
cup. Enjoy on the set. The Super Morning Show is always the best bit. On Joy 99.7 FM.
Abre, do 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 do. Emoshe, anti-scent, anti-taste. Umimi yo, and do me dizzy. I'm running in your code, and do me jaumo, and feel dizzy.
Yeah, welcome back. It's the Super Morning Show. And the numbers are crawling up. So many of them Delta variant here in Ghana. And our vaccine, well, we're told it won't give you as much protection against it as you think. Dr. John Amwesi is the leader of Global and Infectious Disease Research Group at KCCR. He's a senior lecturer at the School of Public Health at KNUST. Dr. Amwesi, thanks again for making the time to join us. So, at Chimota, one school, over 100 cases, most of them Delta. What does this tell us about how pervasive this new strain might be in our communities?
Thanks, Kojo, and good morning again to you and to everyone listening. I think it's really important that we continue our discussion around COVID because of the dynamic nature of this disease and how it really changes with time. And if we lose sight of the ball, we can easily find ourselves in a place where we don't want to be. You may recall that just about 3 weeks ago, in discussions on your network and on other networks, many did mention that we should anticipate in the next 3 weeks this kind of rise. It should tell you that the science really doesn't lie, and the trends are pretty predictable. Also, that our behaviors are largely what will inform the direction in which this COVID pandemic will proceed in Ghana. Now, it doesn't come as a surprise at all that the numbers are going up and that the majority are the Delta variant. I do not know what necessarily triggered the testing at the Achimota school, but what it should tell you is that it should be no different in other parts of Accra or in Kumasi and perhaps the country. And I'll be very interested in understanding what triggered the testing at Achimota. But nonetheless, if you understand where Achimota is situated, very close to the Legon campus, very close to suburbs like Hacho, Westlands, Atomic Energy, and onwards Domi, and in the Kwabenya area, and then further on to the heart of the city in Accra. And you understand that Achimota School also is both a boarding and a day school, which means there's a lot of people that go and come between the school. The school actually has fairly major roads going right through the school. So, I mean, for all intents and purposes, it is only a sneak peek into what is actually going on. Now, the only reason why we may not really perceive what is going on in the full population, the complete population, is thankfully the fact that the death rates are very low. The hospitalization rates are going up, albeit slowly. And so if we rely only on these hospitalization rates and death rates to try to understand the spread of the disease, then we totally miss it. The truth is that it has been there all along, but it is the entrance of the Delta variant which is now accentuating our visibility of the transmission of the disease, one, because it's transmitted a lot faster, and also because it causes a lot more severe disease. But I just want to point out, I'll put it out very quickly, that I'm quite pleased with the Ghana Health Service being really upfront with this outbreak at Achimota School and at other places. And we would have loved for this to have come a lot quicker regarding the spread of the disease and the Delta variant, but always better late than never. I really want to encourage the Ghana Health Service and other stakeholders to continue with this level of transparency and to do even more, because it's really important in our fight. I wanted to talk about a few other things, but let me just pause here in case you have other things you want to ask.
Yeah, so I hear you commending the Ghana Health Service for being upfront about the situation in the school. Now, I don't know whether perhaps because I listen with the layman's ear, I'm not hearing it. But you are obviously an expert in the field, so perhaps you can tell us. Have you heard what the plan is? I mean, this is a new variant. We are not as protected against it as we are against the other ones. We've been asking, so what are we supposed to do differently? It's a different thing, so what are we supposed to do differently? But I haven't heard a plan of how we are dealing with the Delta variant in Ghana. Have you?
No, thanks, Kujo. I just want to address one thing you mentioned, and I'll come to the issue of the plan, which is how protected we are. The truth is, when you say protection, or when we say protection, what do we really mean? It could be protection from getting infected. It could be protection from getting seriously ill and being hospitalized. It could be protection from dying. Now, what is happening is the Delta variant spreads much faster. That's a very important game changer. So you could be doing everything fairly right, or could be doing something which might be holding the virus at bay. But the moment this new strain enters, what you're doing, or the effectiveness of what you're doing, is lowered by the fact that the virus has changed. So what that means is that you also need to change your way of doing things if you want to go back to that level of effectiveness of your interventions or climb higher. All right. Then, when we speak of the protection against it, it's really important to point out that the protection that is offered by vaccination against this Delta strain is actually very high. It may not protect you as much from getting it as it would protect you from getting the alpha or the beta variant, and it's actually just a tad lower, about some 15% lower level. But in terms of getting severe disease, it's almost as up there as the protection that you get from the alpha or beta variants. As for prevention or protection from death, it's almost 100%, actually about 99% protection from death. So if you look in the UK, for example, you see that their numbers are actually going up in terms of infection rates or infection numbers from the Delta variant, but the death rate, in fact, the hospitalization rate, let me just go hospitalization rate, has actually been pretty stable all through, and the death rate is actually falling. So it's really important that when we say protection, we're very clear with what kind of protection we're talking about. Now to the plan that you asked about. I did mention that the moment you get a new variant, which acts differently, it means it cannot be business as usual. The unfortunate thing is that even the little that we were doing, which was protecting us against the beta variant, against the alpha variant, unfortunately, we're not doing as much of that. The hand washing, the mask wearing, the protocols that were preventing us from gathering en masse and so on. All these things have been very relaxed. We're all going for funerals and weddings, and the painful thing is when we go for all these, we're not masking up and we're not doing hand washing. So what that tells you is that even the little protection or the protection you were getting against the previous variants would have been lowered. And then on top of that, you have layered a more virulent strain, which means that your situation or your level of protection would actually be further lowered. So the first thing that we need to do, of course, is to ramp up the protective or the preventive mechanisms that we already know, starting from the protocols at the airport, which I believe are pretty robust. Not I believe, but I know to be pretty robust. The sieve is pretty tight. What we should understand is it's never airtight. There will always be a few coming through. This is just what the science is. You cannot completely prevent, but so far far what we're doing at the airport is great. We should keep it up and tighten it. One little thing I want to add to what should be done at the airport is for airport workers to be tested at least every 3 days to 1 week. I don't know what's going on, but at the very least, airport workers to be tested every week, because these are the people who will come into contact with the travelers who might be infected. And when the traveler is detected to be infected, and we even quarantine or isolate that traveler, what about the airport workers that came into contact with that person? So that's why, and these airport workers will go back home into their community. So it's really important that, in as much as we're keeping it really tight at the airport, we're also testing the airport workers as regularly as possible. I do hope this is going on, and we can always find out from the authorities regarding this. And the next thing is the need for, and I say this, I've said this over and over again, the need for robust sentinel surveys or systems to be implemented across the country, both for being able to detect infection and measure infection rates, and then also to do sequencing of the virus that we detect. Now, these sentinel sites are so important because until you're able to measure the rate of spread, you'll always be touching the tip of the iceberg. Like we heard about Timota School and then one place or the other. These just come to the fore on account of something that triggers somebody to go and test. But what is the reality out there? We just don't know. So we still continue to cruise blind, at least when it comes to trying to understand the rates of infection. The figures that we present every day on the numbers of cases are by no means a reflection of the infection rates in the country, or the spread of infection in the country. It just cannot be, because it's information that you're gathering from your hospitals or facilities or from the places you go to test. So sentinel sites are so critical. Now, beyond the sentinel sites, you also want to continue, and we're already doing some of this. Some of us are already receiving some support from stakeholders, including the Ghana Health Service and others, to conduct seroprevalence studies to try and understand what the levels of infection in the population are in various cities in the country. Very, very critical, because outside of a robust sentinel survey system, it's your seroprevalence studies that will really give you that insight into what the true level of spread of the infection is, and also more importantly, any new variants. And then the final thing would be again just the rolling out of the mass vaccination. For me, this is the only solution. Ultimately, people will get tired of all these protocols and all the lockdown. I mean, lockdown at this time, for me, it's just not an option. I just don't see it happening. It may be effective against curbing the spread, but truly, I don't know if anybody has what it takes to institute a lockdown and whether it is even worthwhile at this time. So I just don't want to even go there. All right, so it's not even an option that we are putting on the table right now. So in the absence of that, the vaccination and getting this through is so critical. And I've heard the Ghana Health Service really pushing this, making it very clear. But my worry is, will people take the vaccine? From the little we've seen and the little we know from surveys, we're going to have an uphill task getting people to get vaccinated.
Well,
and so for me, the seroprevalence studies pushing the vaccination is what we need to be doing, in addition to the about 3 other things that I mentioned.
Well, but Dr. Mwesi, talking about the vaccination, here we're, struggling to get the vaccines. We're thinking of making sure that we're able to vaccinate about 20 million Ghanaians by end of next year. So really, that particular advice looks like it's a difficult one to achieve, isn't it?
Well, it is a challenge to achieve, and if we're talking about 20 million Ghanaians, did you say by the end of next year?
Yeah.
I thought it was this year. But anyway, whatever be the case, we will need to do much better than that if we want to be successful. I'll tell you why. You see, the vaccination is not just about getting vaccinated. It is how quickly you can get as many people as possible vaccinated. Because the vaccination or the production of antibodies will wane ultimately. And what you want is to make sure that at any point in time, you have a large fraction of the population with antibodies in their system. And this is the only way that you can keep that spring depressed. So the moment that you have a lowering beyond a certain threshold of the seroprevalence or essentially the presence of antibodies in people below a certain point, the disease will spring back up. So if you're just aiming to vaccinate X number of the population over a certain period of time, it means that at a certain point in time, you have only a certain fraction vaccinated, instead of having a smaller fraction, instead of having a larger fraction vaccinated. So for me, I would really press that we aim for this 20 million or even more in a much shorter time. And as I mentioned, the challenge for me will be, will people take the vaccine? And the additional thing I want to know in the event of people not wanting to take the vaccine is how many people actually do have antibodies. Because I know in Germany, for example, before you're vaccinated, you have, at least in health facilities and other places, you have the option to actually test or be tested to see if you have antibodies. And if you do have antibodies and the titer levels are high enough, you can be excused for the meantime. Right. So this tells me that if we can understand our seroprevalence, it can give us some level of comfort and confidence in our vaccination scheme to determine who must be vaccinated and how many we really need to vaccinate to achieve the proverbial herd immunity. So for me, right now, vaccinating as quickly as possible and getting over this hurdle or mountain of vaccine hesitancy is what we need to focus on.
Okay, thank you. Now, stay with us, Dr. Amoisi. We're joined now by Dr. Titus Bayo, who is the Deputy General Secretary of the Ghana Medical Association. Dr. Bayo, it's a pleasure. Good morning.
Good morning. Nice speaking to you again, Kojo. And good morning to Dr. Amoisi, my senior colleague, and to other panelists in the studio.
Right. Now, Dr. Bayo, I mean, probably more than half of the effort to combat a public health crisis is in education. How do you think we have done when it comes to education on this new strain?
That's a difficult one because, unfortunately, this new strain is coming at a time where we appear to be in a state of fatigue in terms of adherence to our protocols and even educating the public. And the managers of the health system appear to be in a fix of trying to balance calmness and assurance and maintaining calmness in the community versus bringing up people to realize the actual danger that we face. So you see a situation where the Ghana Health Service, government communicators on this are trying to let us know, look, we have everything under control. We are good to go. But on the other hand, there is a real risk because that type of information therefore tells the people that, look, okay, everything is under control, and so we can relax. I mean, and we need to know where we are in the mix of things because we are at a time when naturally you would expect people to be fatigued with adherence to the protocols. So some bit of positive fear, some bit of letting people know what the real dangers are is needed. You know, so I am a bit worried about how we are educating and how we are demonstrating what we are educating to the people. There isn't much education going on now like it was before, and the acts of some of our leaders is also telling us that really there's nothing much to bother. So even if you as an individual went telling people, be careful, COVID is still around, now we have a Delta variant, people will not take it seriously. And I'll buttress this point by some of the information that we are receiving. We know that the Delta variant, and I want to agree with Dr. Amoisi in commending the Ghana Health Service on one front, which is the fact that they have come promptly to tell us what the state of things are, the number of people where, and what they didn't tell us is what triggered the testing in Achimota. Is it a traveler's kit that went there? Did the student just pick it from the community? How did that outbreak happen there? You know, because when you give out the figures without telling us the how, then it's difficult for other, people in academia and other stakeholders to appreciate what the real situation is. And that is where my point of balancing the education comes in. Because this Delta variant, as we know, is more infectious. In an unvaccinated population can be very deadly, you know, and we are having a situation where our vaccination rate is very low. And we are following the same trajectory again. And this is going to be the third time this is happening to us, where we begin by assuring ourselves, patting ourselves in the back, look, there's nothing much wrong because very few numbers are coming up and nobody is dying yet. But this is just a normal trajectory of this disease. Dr. Amwesi made a comparison or made, I think, the feedback of what's happening in the UK, where infection is going up with this same variant, as people are dying. And this is because a lot of their population is vaccinated. We have very, very, very few percentage of our population vaccinated. So in the initial stages, as it is, the infections will be inching up. And if you look at the people that have been infected, these are healthy states. So we don't expect a lot of hospitalization among them. We don't expect a lot of deaths. Most travelers coming in may be healthy young people who are around because of the risk. People who are at risk will not even want to travel around this time. So again, this variant is going to spread in the population of people initially are not too susceptible to it in terms of hospitalization and death. If we use these statistics to assure ourselves and communicate to the public as though there is nothing wrong, then these people will come in contact with a lot of our population who are not vaccinated, who may be susceptible with underlying medical conditions, elderly, who will catch this variant, and then we begin to see our hospitalization going up. It will take a while, then mortalities will follow. Then we will realize that the robustness of our system we are talking about in terms of care, which is the point that we come in, will not be there. Because we're challenged in January. I admit we have improved our infrastructure, we have done our best. But look, in the best of systems, when you have an overwhelming cases, you are not able to handle it. So we should let the communication go in a way that there is a balance between trying to maintain calm and letting people know what the real danger is in a few weeks if we keep on in the same lifestyle, where everybody thinks we can have our parties, we can have our funerals, we can have our mass gatherings. To hell with the protocols, because after all, we are just getting about 80 cases per day with a variant that we know is very, very contagious and very high.
Yeah.
And a lot of unknowns, as Dr. Amwesi has alluded to, in our community. Then it leaves cause for concern. So I think that is just my issue with the education bit.
Okay. Let me ask Dr. Amwesi this question. It seems that amongst our population, people are starting to think, well, the evidence does not bear out the concern and fear that some people seem to have of this virus. Yes, variant or no variant, we're not seeing deaths. In fact, somebody did some analysis that last year, cervical cancer killed more people than COVID. So why are we worrying about COVID? Are we making a mountain out of a molehill? And of course, this is coming from people who clearly are suffering a bit of COVID fatigue. But are they right?
Thanks, Kojo. I think it's a great analogy that you have used, cervical cancer, and there's several others that you can use. In fact, we do use these kinds of analogies in pressing home the relative importance of one disease or the other. But what we need to understand is that COVID is, first of all, a new disease, which is evolving, and we're still learning about. It is true, if you do look at the all-cause mortality numbers, particularly in Ghana, you will not see a major change in the sense that mortality rates in Ghana have not been significantly, or figures in Ghana have not been significantly affected by COVID just yet. But as I always say, in public health, you look at trends, you try and understand the figures, and you make sense of those to make decisions that would potentially save you death, that will save you economic loss. Let's take, for example, the UK and their initial decision to go for herd immunity. Now, this was based on their understanding of infectious diseases. Again, this exact same notion that, well, some people will die ultimately. And so let's just get on with it. We will bite the bullet and take it from there. Now, that turned out to be disastrous, as we all know, and they changed course, went in for the hard lockdowns, accelerated vaccine development, and now they are totally on top of the game in Europe. We saw exactly the same thing in Brazil, with the charge being led by President Bolsonaro himself, who eventually did get COVID, but took this approach of we're not really seeing it as bad as they say it could be. Our economy is really important. We cannot live our lives cowered down all day long. So let's just get on with it. And we saw the disaster in Brazil, right from Rio de Janeiro to Brasilia to even the Amazon and other parts of Brazil. And I have friends there. I was in several calls with friends in Brazil who were giving me the real figures and the real time events going on there. Let's move to a place like India, which actually begun to pat themselves on the back and congratulate themselves that they had done a good job and that they really needed to open up. And we know how the Indian economy functions. We rely on it heavily. In fact, China and the Indian economy we rely on very heavily in many ways, including for our drugs. And the pathetic thing about India is the fact that this is a place where they have the largest. That is almost foolhardy to say, well, because it may not end up being that bad. So far, it's not being that bad. Let's just get on with it, and then it's never going to get that bad. That is simply wishing it away, and it can result in disaster. So for these reasons, we cannot afford to say that so far it's not been so terrible in Ghana, and we can afford to get on with life. If you look at what's happening in Zambia, look at what's happening in Uganda, in South Africa, in Kenya, currently, it should just tell you that if we don't do the right things as quickly as possible, we would not like what might happen. We can. And for me, again, I reemphasize, getting those vaccines into the arms of people is the way it should go. It's been proven in Israel. It's been proven in the UK. It's been proven in the US and in many other places. I don't know why we should do anything different. So certainly saying that because the figures are not looking so bad, we should get on with it. There's enough evidence to show that that's a false premise.
Dr. Bayo, I've got about 30 seconds before I have to pick calls, and I'm curious to get we had events, things we should not have been doing. We're seeing a pattern again. If you go on social media, you see people active in Stone, all of them attending events, holding concerts. We've seen politicians, the president going to funerals. We've seen all of these who have been to the same locations, same events, and carrying, and demonstrating in a spread of the infection.
Okay. So, because of your time limit, I will just give a summarized answer to this. That it will be unscientific to expect that direct link immediately. And that is why when people say that, GMA criticized John's funeral, let's wait and see in 2 weeks if we will get people who attended that funeral reporting to the hospitals. No, that is not how this disease functions. If we want to establish that link immediately, then we will get a full-blown epidemic before us in a system that we cannot handle. It just doesn't work that way. The numbers are inching up. You will not be able to link it immediately that somebody went there because, remember, it depends on the susceptibility levels of the individual. And some of these people may have been vaccinated. They will catch it. The vaccine may protect you against hospitalization, may protect you against death. But remember, there's another person there who is more vulnerable. So when these events are happening, it's difficult to do any form of contact tracing. It becomes a very terrible matrix because one person goes for a party and if the person is positive and you want to contact trace, it's just something. That is why we are saying these gatherings provide ground for the spread of the infection. It may not necessarily translate immediately into hospitalization, but it is just a matter of time. Let's not wait to see that, 10 people who went for this church service have reported to the hospital. No. Let's look at our prevalence in totality, because that is what is important. What is the prevalence in the population? And when is it going to get to the at-risk population who would be sick and who may die?
Right. Thank you. Thank you for that, Dr. Titus Bayo. Thanks also to Dr. John Amwesi. Dr. Bayo is the Deputy General Secretary of the Ghana Medical Association, and Dr. Amwesi is the leader of Global and Infectious Disease Research Group at KCCR. He's also a senior lecturer at the School of Public Health at KNUST. God bless you both for your time. So, look, it's your show, so let's talk, okay? I'm curious. I want to know whether you are experiencing COVID fatigue. Whether you are starting to think, oh, this thing, hasn't it gone? Can't we go back to holding our funerals and weddings and all of that? After all, we are doing it and nobody is dead. So can't we just proceed, as we've started? Or are you worried? Are you afraid of something around the corner? Also, how willing are you to adhere to these protocols when you are seeing so many examples of people not adhering to it? Let's talk. 0302 216 541 or 055 1111 997. Call us. It's your show. We'd love to hear your voice on it. Okay? Ray.
Yes. My experience with COVID makes me consistently fear any news related to COVID. And because of that very painful, excruciating pain that I went through, I consistently adopt the position that I am better off taking precaution than letting my guard down. Unfortunately, for some weeks now, there are so many people who will look at me in the face and say, "Why won't you take this mask off? Are you the only person in this republic?" Oh, I have taken 2 vaccines. The person I'm talking about has not taken any. But I'm so convinced that I do not deserve to protect myself, and he is not in any danger.
Castor is in Adabraka. Castor, good morning.
Good morning, Kojo. I don't know, but I am observing the protocol. I feel COVID only comes up when government wants to stop something. And that is the impression I'm getting. If it's stopping demonstrations, if it's about going out to borrow money, if it's about cutting back from increasing the salary of workers, COVID becomes a convenient excuse. This thing should stop. It should stop. Thank you very much.
Thank you, Castor. Na is in Spintex. Na, good morning.
Good morning, Kojo. Good morning. Yes, I have a question.
Sure.
Yes. If I'm not mistaken, I think the number of people who have been vaccinated is about 300,000 plus. Am I correct?
Yes, about 350,000.
Okay. And now the government is also saying that they are making serious attempts to get more vaccines in, right?
Yes.
Okay. And the vaccines that came in were mostly donated through the COVAX program, right?
Correct.
Okay. Now, we are a government, or we are people who like to borrow a lot towards the future. Okay. Now, I'm going to ask, why can't this government go to places where we can get a vaccine and borrow money to come and vaccinate over 20 million people? Whereas they are now telling us that they're going to try and finish vaccination by the end of 2022. If this thing is as serious as they say it is, and it can really affect us, and now we're even having problems with what's happening in Achimota, maybe other schools also, we don't know. It's going to go into the population. Why can't this government go and borrow money from its friends abroad and bring the vaccines in and do it as a matter of the agency and vaccinate people? Why are we not borrowing money to do this? And yet we are saying we are looking for money to do it for ourselves. And yet we borrow money for other things. And this is a crucial life and death matter for our people. Or it doesn't matter if a few of us die, it's fine. Because I know that majority of government officials have been vaccinated. That's my question. Thank you.
Thank you, Na. I'm sure there are people better qualified to give you a full answer. But one thing we have learned is that the problem is not just money. The problem is that you can't get the vaccine, even if you have all the money in the world, because there's a queue of countries who have invested in the manufacture of the vaccine, and they are buying them up to protect their population. So even when you have money and you go there, there's a queue. You can't get access to the vaccine. So I don't know if it's about borrowing The truth is that even if you have money in your hand, you might struggle to get it. But thanks for that question. Kwabena is in Tema. Kwabena, good morning.
This is Timothy.
Oh, it's Timothy. Thank you for calling us, Timothy. Good morning.
Yeah, good morning. I hope you are fine, sir.
I'm very well, Timothy. Thanks for your call. What's on your mind?
Yeah, good morning to your discerning listeners. You know, Kojo, let me tell you this. Yesterday I was walking around Medina Zongo Junction. I had protected myself, but I felt like, wow, is Corona really existing? And I felt so bad because I was the only one in a mask. I was like, wow, I just moved a little bit further before I saw one lady from church also having her mask on. So apparently it was because maybe she was even from church where it is required to wear it. You know, Kojo, it's so disheartening. We have to, the government, for me, I will always hate them. And I'll let everyone do what is right. Even if I belong to you and you don't do what is right, I'll let you know. The government must sit up and do something about this corona and this protecting ourselves. Because if this new wave they are talking about, it becomes too tough and strong. Is it now that the issue has come up before we are not going to curb it? Prevention is better than cure. So let us not let the issue escalate before we want to find ways and means of solving it. Now that we have been told it's now approaching, let us find ways and means. Let the government put in some measures, like how it did, so that people will take it serious again, so that we can be safe. Because I am protecting someone, because I put my own. What about the other person? What is he doing for me? The government must step up.
Thank you, Timothy. Let's go to Tema and speak to Kwabena. Kwabena, good morning.
Good morning, my brother. How are you?
I'm very well, bro.
Okay. Because I think that it is important that we pay attention to the protocols. But if we are not careful, we will place more emphasis on COVID than we should actually do. Like you said, we are having more deaths in other areas than COVID. And you asked the question, I was hoping that I was going to get a direct answer in terms of we are having parties, we are having the social gathering. What are the effects on the numbers? Are we having the effect on the numbers than we used to, or we are not gathering the data? If we are not having the effect, even though we are having more parties than any time during the COVID era, then are we not placing so much emphasis on COVID and then ignoring other ailments that are actually also killing us?
Okay, thanks for your question, Kwabena. Let's stay in Tema and speak to Kobe. Good morning, Kobe.
Good morning, Kobe.
I'm an Adum chief now. Where?
Okay.
Correct. What's on your mind?
Where did you get that impression that even if you have money, the product is very scarce and you can't buy it?
It's not an impression. It's a fact. There are several countries, including Ghana, that are trying to get the vaccine but can't. They can't get it because the manufacturers have already booked them out to other countries that are ahead of us in the queue. These are facts. It's not an impression.
Since when did these manufacturers started producing the vaccine? It's been so many months. And are you telling that this manufacturer, look, there's not only one manufacturer. We have multiples of them. And we are over 5, 6, 7 months now. Are you saying that they don't know, they cannot estimate the total number of the population of the world, that in producing these vaccines, they cannot factor that in? If our governments are telling you, look, we have the health minister, coming to tell you that they have contacted even the Russian embassy, and the Russian embassy has come out to refute even that. So if there is that impression going out there that government is telling the people of Ghana, hello?
Yes, Kobe, forgive me, but if you keep calling it an impression, I mean, it's a fact, okay? There are countries that have bought 3 times their population of vaccines, okay? 3 times their population. So before the next country gets it, they have hoarded 3 times their population worth of vaccine. So it's not about the manufacturers not knowing the number of people in the world, but the people who are buying it, the people who have the control and are able to buy it, are buying it all up as fast as it is manufactured.
Okay,
that's why countries like ours haven't got any.
Could you just a quick one?
Yes, sir.
US has a population of less than 300, right? If US is buying the vaccine, I'm sure they will not buy more than 300 million vaccines.
They have. Okay. They've bought more than 1 billion of them. They've ordered more than 1 billion doses. They have. This is what I'm saying to you. That is what is happening.
Okay. All right. That is fine. Ghana, what is our target with respect to herd immunity? Because so far, as well as I'm aware, government has vaccinated over 300,000 people, and the population of Ghana is almost about 30 million, right?
Yes. We are told that the target is 20 million people by the end of next year.
And as we speak, we are just around 300,000.
Yes.
And the excuse is that the product is scarce on the market to get, right?
It is scarce on the market.
Okay, anyway, thank you. Thank you. Have a good day.
Thank you for calling us, Kobe. Thanks very much. Dennis is in Accra. Hi, Dennis. Good morning.
Good morning, Kojo.
Thanks for calling us, bro.
Thanks for a good job you're doing for this great country. Let me just pass on this information. One, there will be a gathering at a particular place this afternoon where a lot of people will come and gather to watch a football match. This has been going on for quite some time now. I have been there once, and I noticed that a lot of people don't wear the mask. Maybe I can give the location of maybe after this call.
Yes, please.
For me, I think a lot of people have dropped their guard concerning this COVID issue. I've had my jab like twice, but I still protect myself. But hey, when you talk to people outside, they don't even care about COVID. Trust me, they don't care. Especially when you go to places like main Accra, like Jamestown, Choko, Mamprobi, and some of them. You dare not even raise COVID. If you are not careful, you'll be slapped. They don't just care. You can take a stroll and check for yourself. But hey, people don't care anymore about COVID. That's it. Thank you very much.
Thank you so much for calling us. Thanks to all of you who have called us today. We appreciate your thoughts. And look, in the end, only you can save you. So make a decision. Are you going to make that last push? That last push to get to that point where we are actually safe? Are you going to hold on just a little bit longer? Until we've got this thing under control? Are you going to stay with the protocols? Protect yourself and your family just one more time so that we get to the point where we can actually breathe easy? Or are you going to prematurely celebrate and start to live as if things are back to normal and turn this into the nightmare we have all been afraid of? Choice is yours. In the meantime, we are excited here because Ghana Black Stars captain is here. We can't wait to talk to this year's Footballer of the Year. Former, I don't like adding former, recent Swansea player. Recent Swansea player. Dede Ayu joins us on the Super Morning Show. Stay with us.
Joy 99.7 FM.
Social distance and weapon all one surface seminar, sanitizer
Joy 99.7 FM.
Imagine say water wake up at dawn. You know both. You know chop. Where it vanish for your area for 2 weeks. You not get one drop safe inside your tank.
Hey.
Hajia, our life was in danger.